So tell me why you sought us out.
Really sick with vertigo. But I didn't know that was connected to the fact that I had really bad jaw pain. I had a root canal, had 2 teeth done, 2 crowns, and it was off. And I kept going back and saying, hey, it's my jaw hurts. It's, pain. It's discomfort. Fixed it. I went in and got it fixed 3 times.
When you say fixed 3 times, you had 3 root canals, or you had the bite adjusted 3 times?
Bite adjusted 3 times because they did the root canal, put the temporaries on, had no problem with the temporaries. And that was a few weeks I had that temporary on, no problems. It's when they put the permanents on that it was like, something's off, something's wrong. So I went back in, they fixed it. A couple weeks later, I'm like, no, I'm biting my tongue. Something's wrong. It's hurting. My jaw hurts. Went in again to get it adjusted. Then that was my dentist. I went back to the endodontist that did the root canal and said, can you just pull this tooth because there's something wrong? And he adjusted it a little bit. And that's when I was having severe vertigo, but I never put vertigo and that together. It was just that I was having all these symptoms. Well, I ended up in the hospital with the severe vertigo. And they said it was trigeminal nerve and, so all these things. And I thought, okay, I had that root canal. Maybe it is part of that. But then they started looking at more like neurology, like it's making sure it's not a stroke, making sure it's not all these horrible things. And so I've done every test, and nothing has come back. Nothing. I've had a CT scan, an MRI with and without, an MRA, angio of my vessels. I've seen an ENT specialist and did all the tests for him and said no, hearing loss, no, it's crystals. I went to a therapist, a VRT, did visual therapy because they thought it was crystals out in my ears over and over again, but it wasn't. So yeah.
Did they say that it wasn't?
I said that it wasn't because I didn't have this thing with the eyes when they would do the maneuvers. And she said, well, you must have already put it back when you did the maneuver at home. So it was one of those things, but I'm like, but why would crystals don't just keep falling out over and over again? So I thought it can't be the crystals out in my head, or whatever, the BBPV. Then told I had PPPD, so permanently dizzy. I didn't like that at all, but that's what I started looking. My husband, not me, my husband looked and he saw one of your videos.
Sure.
And it said she had talked about how she had the vertigo, had all the same symptoms as me. And he's like, you got to watch this. So of course, when I came home, he's like, you got to watch this. I watched the video, but then I ended up watching several of your videos and everybody's story so mirrored mine that I was like, I gotta see you. I gotta see if if I wouldn't have had the crowns done, I probably been like, that's cuckoo bananas. Because,
yeah.
I don't believe that it would be something to do with my bite. But because I had the crowns, I was like, it's gotta be, because that's where it started in January is when this all started. So, and then looking at the video, I called you, and then I found that you were only 5.5 hours away. So I was like, I'm driving.
Only.
I say only because I was willing to drive anywhere at this point to see if, and literally my appointment was the 23rd of June, and I have not had a headache since the 21st of June. Haven't had neck pain since after the adjustment. I did have a couple of the vertigo, not attacks, like the drop attacks like I was having, but vertigo issues the week after I saw you. I had an episode, but that is the last time I had a vertigo episode.
Sure.
And then my dizziness now, when I do the lane and go to the left, I would get dizzy, but now I can lay down and go to the left. I have PTSD, like I'm going to get dizzy and I have to calm my anxiety.
Sure.
But because I was suffering from very bad anxiety, because everywhere I went, I thought I was going to have a drop attack of vertigo. So a lot of anxiety, but that's way better too. So.
Well, the interesting thing with the anxiety and which can lead to depression as well.
Yeah.
When you start feeling better and you start to have hope and there's some time that you're getting under your belt to, because this thing is cyclical, right? So you could have a week or a few days where things are pretty good, not great, but you're not laying on the bathroom floor waiting to throw up.
Yeah.
And then, you think, oh, well, the longest the longest I've ever gone feeling good is, 3 weeks or 4 weeks since this whole thing started. And now you're at 2 months. You're like, okay, well, probably, we figured out what the problem was. So did you have any diagnosis that they gave? Did they give you a trigeminal neuralgia diagnosis?
In the emergency room. So the first time I went to the emergency room, they just thought it was a vestibular migraine.
Okay.
Second time I went to the emergency room, when they did a CT scan, they did see some a residual infection where that root canal was, but the inflammation. And so they said trigeminal nerve inflammation, and that's why they referred me to a neurologist. So that was kind of a diagnosis, I guess, because that's why I got to the neurologist was trigeminal. The third time I went to the emergency room, I said only a couple times, this was really bad. They were like, yeah, the TMJ, your jaw is so locked and your neck and everything is so locked up. It's probably something to do with your muscles too, and trying to get me on muscle relaxers, you name it, which I did not take. So, might have helped at the time, but I don't like taking anything. So, but then like I said, I was diagnosed with vestibular the actual diagnosis on my thing that you would see was vestibular migraines. Is what even the neurologist after I seen her said, no, they don't think it's trigeminal nerve as much as it is vestibular migraine. But I did have a trigeminal nerve inflammation diagnosis, vestibular migraine, BPPV, PPPD, because that's just like the generic, you're dizzy and you're just going to be dizzy and it could go away, it could come back, we don't know. I think that's the neurologist's way of just saying, I don't know how to help you. But other than that, I think that's the other diagnosis that I've had. No real diagnosis.
Sure. Okay.
No one told me I had Meniere's or anything like that. And that's where I thought I was going with the lab or whatever that is in Meniere's. But
sure,
they said my hearing was great and
okay.
ENT. But
well, good. Okay. So let me ask you, were you avoiding sleeping on one side versus the other?
Yeah, I could not lay on the left side. I couldn't lay flat, but I could not turn to the left whatsoever or lay on the left side. I can now. Now it still gives me anxiety to do it, but I can do it, and I do it.
All right. So we had to sleep elevated. If you couldn't lay flat and you couldn't lay on the left side, how do you sleep?
Propped up on the right for 2 months, probably straight, literally pillows propped, and I could sleep on the right, but I could lay flat on my right side. But I could not roll over. So if I needed to move from that right side, I had to sit straight up because it would put me in a vertigo spin.
Okay.
But it was like my neck and I think everything was just so bound up.
So you're able to sleep flat. You're able to sleep on the left side.
Yep. And I roll from one to the other. It just gives me anxiety a little bit, but I can do it. So I kind of make myself do it because I don't want to avoid part of just, but when I lay there, I do feel a little bit of that pressure, pain, depending on how I lay with my arm or something. So I try to avoid it a little bit more, I think still, but I'm doing it more and more. But I could not even go to that side at all.
And you'll probably get some more out of this, as time goes, right?
Mm-hmm.
It's a pretty big jump to go from where you were to where you are.
Yeah.
But I've seen patients continue to heal 10, 12, 18 months after we stopped doing the revisions. So that's kind of an interesting thing. So even after we're done, you're probably still going to have some slow, steady, incremental improvement.
So I think right now my biggest thing would still be the brain fog and fatigue, and I feel a little like getting off the elevator still gives me those little, I call them vertigo glitches is what I call them. So anytime I get like that off where my body's a little sway, I probably wouldn't be able to go on a boat or anything like that right now because it would make me feel a little off. And that's more of an anxiety thing, I think, thinking I'm going to have vertigo. So if your husband found the video originally, yes,
what does he say about all this? I'm sure you guys talk about it.
Yeah.
He's seen quite the change in you.
Yes. He's like, it had to be, well, because what was it? We've, what is it? What's going on with me? obviously not a stroke. It would have showed up on the, all these things. And he says, well, it had to be what it was. It had to be. You're feeling better. You're doing better. But we also do think it was like, because that was off and because I was so messed up that it messed up my neck, and doing all my research, knowing that C123 is part of your third of your vestibular.
Yeah.
And so that's when for me, educational, I was like, that's where it makes sense to have the vertigo, because I was so messed up and my body was so off balance from the teeth bite that it messed up my neck.
Absolutely. Can happen. Absolutely.
Yeah.
It's interesting. I ran across, I'm a member in a forum where it's all like, dentists. It's kind of run by dentists that are in the oral facial pain specialty, right? Who don't believe that the bite has anything to do with what you just described, right?
Oh, I would have to disagree with them. But.
And the interesting thing is like one of them, I'm all for like education and like let's share information, and I'm sure they do good work.
Yeah.
But to come out and say that one has nothing to do with the other, when like, I don't think you need to have, a psychiatric evaluation just because you come in here with pain. I certainly don't think that, we need to run, all of these tests again that you've already had run. Right. And so then the obvious thing is, well, I'm still responsible for your bite. Every single dentist on the planet is responsible for really three things: decay, it could lead to abscesses, gum disease, and the bite. And, like, whoa, it's funny. And I'm kind of picking on this guy a little bit, because he said in one of these online things, I don't think there's any patients in there. I think it's all dogs. But he said, well, just adjust my bite and my headaches will go away. My jaw pain will go away. My neck pain will go away. My sleep will get better. The vertigo will go away. Said no one ever. Right. And I'm like, you just said all those things. And so my experience is different than his experience.
It is.
But for someone to say, especially a dentist, and is from just wildly ignorant. Now, if you don't want to treat the way I treat, treat any way you want to treat, right? As long as the patient's happy, I don't think anybody cares. But for you to come out and say the way this is being done does not meet the standard of care, and they don't treat the kind of patients.
My neurologist agreed, because she's seen me from the second or third ER visit, and she's seen me a few times. And the last time that I went to her, and I could tell her it had been like 3 weeks since a headache, and I told her that I thought it was from that. She totally agreed, and then she sent me to a physical therapist to help with just neck and just muscle stuff. But she totally was like, I could see how that could totally be what caused this whole thing. So she agreed. And she's a neurologist.
Well, she's
probably one in whatever.
Yeah, right.
But she agreed that because she's seen me and she saw that I was doing better. And the only thing I did different was come to you.
Yeah. So I appreciate that, because I've kind of given up on like, hey, did you think of this? Or hey, did you think of that? And they don't really return my phone calls. They don't really reach out. But when a patient goes back in their office and they say like something you said, where the only thing that's different is I went and had the bite adjusted. What else could it be? I mean, maybe it just spontaneously resolved at the exact same moment I did the. And I think,
right? Can I say that that's not it? You know what I mean? But come on, if you would have seen me, even my first visit, you saw I was in tears. I was dizzy as all. I was so sick and dizzy the night at the hotel next door. So no, literally. Night and day, my daughter, who had just had a grandbaby, like being able to help with my granddaughter, I'll cry now just thinking about the things I've been able to do since it's been done that I was not able to do, brings me to tears. But also my physical therapist is probably going to be calling you, because when I gave her the information about you, she's like, oh my gosh, I've been looking for someone to fix my bite, because she knows. And she agreed. So that's a second person now. Yeah. Melinda over at the Rose Center, who is very popular with everybody there for physical therapy. She has me doing some neck exercises and some things, but she's seen the improvement over the weeks that I've been to her. And yeah, I've been doing stretches and things to loosen up and help keep my neck going and my jaw going. But she was like, I want his phone number. So I gave her your information.
Well, sure. And I think, it's multifactorial for sure. But what would you say to somebody that said, well, the only reason why her neck got better is because she was doing the physical therapy?
Mom, I was getting better before I went to physical therapy.
Yeah. Oh, okay.
Yeah.
All right.
No. I was actually doing way better. I was already 3 weeks into feeling way better, no vertigo, when I went to physical therapy. So it had been about 3 weeks, and I saw my neurologist, and probably another week or so before she referred me over to the physical therapist, because she agreed that it could, because everybody already said in the beginning, TMJ, trigeminal nerve, neck pain, headaches. They all knew something was connected. It just didn't start getting better until I saw you. So,
okay. Well, and that's the reason why I like to make the videos, because patients telling their story in their own words.
yeah.
Well, I mean, your husband's a prime example, and just seeing, patient after patient saying, oh, well, I have that and I have that too. And oh my gosh, they got better. Well, my bite doesn't feel right. Well, maybe that, this is part of the problem. And so you're going through this process of checking off boxes, right?
Mm-hmm.
So, okay, well, it doesn't involve surgery. It doesn't involve medications.
Yeah.
In fact, I don't even get numb for this. So, why wouldn't you check it out?
And try it.
Yeah.
No, when especially I'd already been to several specialists, several doctors. I was so sick and so hopeless. But when I saw your video and they mirrored the same symptoms with the vertigo and the neck pain, because when I described the headache and the neck pain, like somebody else had described it the same way. And I'm like, it's gotta be my bite. It's gotta be the same. And I was hopeful that that's what it was. And, okay, I willed it to happen, but it didn't start feeling better until after I came here. So, and I'm smiling and I'm doing and I'm working and I'm looking forward to a school year that's starting pretty soon. I'm fatigued, so I a little worry about that, but I didn't work half of March. April, I did not work. May, I worked a few little bit, and it really messed with me. Yeah, I wasn't able to work. I've never missed a day. I have 30 years of teaching, and I've never missed work except for a conference. And I missed 3 months of on and off all the time. It was horrible. So I don't plan on missing any work.
Well, I'm glad you're here. I'm glad you're allowing me to share your story with, I think, others that are going to, see these videos. And we get called. I did a Zoom conference with, a couple of patients in different countries last week. And I'm trying to, go see that guy, go see, somebody who's closer to you or somebody who's in your own country. And it's the patients are the ones that are driving this, right? It's not the profession. It's not dentistry. It's not medicine.
Well, even when I looked up TMD specialists that were in my area on the link, it was like everything I looked into them, because there was a few closer. Bend, Oregon's probably not closer, and then somebody in maybe San Rafael or San something. But I was like, they didn't have the information or the knowledge on their website or on their connections for me to trust that it was what I was getting was the same thing that I was going to get from you. So I would hope you train way more people, or more people would be accepted to the fact that a bite can cause all these things. So,
well, from your mouth to God's ear. Okay. Anything else you want to share?
Not that it's worth it. I'm glad I only had to be 5.5 hours, because if I was more than that, I still would have drove, because I was no way I could fly. I don't know. I hear the stories of people flying or coming from all over, and I'm like, I couldn't have, in this condition I was in, I barely could have drove here.
Well, it's sad, because there's a lady in Arizona I just wrote a big refund check to, because she's so sick she can't make it up here. But I don't know if it's directly this or it's a comorbidity of something else that's got her bedridden and she can't get up here.
Yeah.
So at some point you got to say, look, let me just give you your money back, and when you get to feeling good enough to travel, then let's do it, right?
Oh yeah.
But I can't just hold on to the money and not deliver something.
Yeah. No, B had, like, when I was over in the hotel, sleeping is where the vertigo really would mess with me. And that was a whole ordeal for myself, just to stay in a hotel. Like, I've been going and staying in hotels all over since this, a couple of different times now. But it's like going to a hotel knowing that you're going to be that sick, not at home, is really hard. So I totally understand. Like, not being able to go far
Yeah.
I'm glad you were only 5.5. You say only, but yeah, it's actually doable in a day if I had to. So,
Well, yeah. Well, I had the longest, the record, I think, for somebody driving to the office is Naples, Florida.
oh my gosh. But I would have probably done it if
it was
I knew
an air issue, and she was afraid of the cabin pressures in the plane, the plane, and like, well, you got to drive over the Rocky Mountains. Like, no, we're going through Arizona and then up.
Just to avoid it.
Just to avoid the elevation change.
Yeah.
And I'm like, oh my God. And then after the second visit, she was flying.
Yeah.
She was able to fly. So,
yeah. So I'm just hoping it just keeps getting better. Yeah.
Yeah. Well, thank you for letting me share your story. We're not done. We're not out of the woods.
No.
Like I said, this is 4 to 6 visits at least, and we're in visit 3 today.
Yeah.
So, we're going to continue to follow, but, is it all right if I post your testimonial for?
Of course. Yeah.
Okay. Glad you did it.
Yeah. Oh, yeah. Oh, man. Yeah. Night and day.